Hi, my name is Liv Swanger, and I'm a PharmD with the Pediatric Clinic, and I was calling for Dr. Tom regarding our mutual patient. His name is Seth Jacob. He's an Alaska Native male that was born on 7/20 of last year, which makes him 16 months old. So the current situation at hand is that he does have what appears to be acute, non-severe unilateral otitis media of his right ear, based on many of his signs and symptoms. I would rate this a moderate, not severe case. He has been tugging at his ear. They are tender, and they are expelling some discharge, according to mom. He's also been crying more, has had a decreased appetite, decreased playfulness, and a harder time sleeping, which is all typically seen with otitis media. And on his physical examination, he did have a tympanic membrane on his right side that was bulging red, and there's also built up fluid in his ear. So some background on Seth. Overall, besides his ear and a sore throat, his physical examination was good. Vital signs are all within normal limits. Seth is a full-term baby. He's fully immunized, including Prevnar 13. He has a good home life from what we can tell with his mom, sister, and dog at home. However, the mom is wanting antibiotics. And I feel that she may be pressing for antibiotics because she's fearful of having to stay home or be out of work. She's an accountant, and with it being tax season, her job is really needing her right now. So I feel that her pressing for antibiotics is just that she's fearful that her son might be getting sick and she might be missing out of work. And so it might do some good just to ease her mind with everything, that he potentially doesn't have an ear infection requiring antibiotics. And my assessment is really that he doesn't qualify for antibiotics. This has only been going on, these signs and symptoms have really only been going on for 24 hours that we can tell. And also his temperature is 38.2 Celsius or 100.8 Fahrenheit, which doesn't meet the criteria per the American Academy of Pediatrics, which for antibiotics would either need to be considered severe, such as having a bilateral signs and symptoms in both ears, a temperature of 39 degrees Celsius, and having signs and symptoms for greater than 48 hours. Majority of times, these symptoms will resolve by themselves without antibiotics. And the antibiotics, adverse reactions, including diarrhea, stomach upsets, things like that, might not be worth it if he really doesn't need them, which is something that we can educate mom about. But what I would recommend is, once again, not prescribing antibiotics, and we can continue that ibuprofen as dosed. I would maximize that at 72 hours because he's already had 2 doses within the last 24 hours. I wouldn't do continual therapy with ibuprofen beyond 72 hours. Also, we want to just keep an eye on him, making sure he's staying hydrated, he's getting enough sleep. We also want to be checking for his fever to see if his fever is potentially getting worse. There is risk of that NSAID decreasing the fever, and so we're not seeing what it would be without the NSAIDs on board. And also, we want to make sure that mom can clean his ear, like on the outside, externally, but to make sure that she doesn't use any Q-tips or anything, because his ear is very sensitive, and we want to make sure that no physical damage is done using Q-tips. Other than that, he's currently taking ibuprofen suspension, 100 mg per 5 ml every 12 hours. That dosage is totally fine. I'm okay with that. And if you have any questions, please feel free to give me a call in pharmacy. And my resources were the American Academy of Pediatric guidelines for acute otitis media and the CDC. Thank you.